Thank you for joining Cancer Support Community Atlanta for this program. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. We invite you to sign up for our newsletter to stay connected to all future programs.
Well, welcome everybody. So glad that you're here. Is it anybody's first time here at Cancer Support Community Atlanta? Don't be shy, wave them high. Welcome, we're so happy you're here. I'd be happy to give you a brief tour when we finish up today, but we're so happy that you have joined us. And I won't go through all the programs that you see behind me, but as you can see, we offer a wide variety of things from support groups, nutrition seminars. We have really fun cooking demonstrations that happen here in the kitchen too. I know some people here join the cooking demonstrations. Do you want to share how they are?
Wonderful.
Wonderful. Thumbs up. We have a really good time and you get to eat delicious food after. You don't have to do the dishes. It's a total win. So please feel free to join us for that. We also have stress reduction classes. So I'm going to highlight tomorrow we have a lymphedema program starting virtually. It's not too late to register. You can register online and it's through Zoom, so you can join us from anywhere. I think it's a 4-part series with Bev, and she wanted me to highlight that it is a gentle movement. So please don't feel like we're going to throw you an Orange Theory. It's gentle movement, and she's really great at adapting things as needed. So again, it's not too late to register for that lymphedema series. We have some papers out for that on the counter, but you can also, as always, visit our website and register through there. So I'm also going to highlight a fun event that we're doing is some dominoes. It's on September 8th. It's in here. So if you want something lighthearted and fun just to connect with others, please feel free to join us for some dominoes. And then we're also doing an in-person support group. I don't know if you guys are aware, we've started bringing back a couple in-person support groups, and one of that is Beyond Cancer Support Group. So if you'd like to connect with others who are post-treatment in person, that's a great option. It meets again here. So you can see all those programs and more at our website, cscatlanta.org. And the last thing I'm going to share is that, does anybody here have Instagram or Facebook? All right. Well, we are now on Instagram and Facebook. We're getting with it. So please feel free to give us a follow if you want to check out photos from past programs, or we do really fun educational videos on there. Or just to learn program updates. So please feel free to check us out. At every table should be the QR code that you can scan and connect to Instagram and Facebook. So give us a follow, give us a like. We'd like to see you in the comments section. All right, so I think without further ado, I'm excited to start today's program of events. Let's see. Always in theory, this works. Perfect. That might be, there we go. All right, so I'm going to first pass it off to Dr. Barnes to share some opening remarks with us, and then you're going to hear from Abbey Wright with Northside Rehab, and then we're going to take a break, and then you're going to get to check out some really cool products from A Wellnes Place. They're an amazing resource through Northside. They're going to kind of share about what A Wellnes Place does and share some of those available products. So without further ado, I'm going to pass it off to Dr. Barnes.
Hi, I'm so glad you all could come today. Welcome. I'm curious how many of you are here because you want to learn more about preventing lymphedema? And how many of you are here because you want to learn more about managing lymphedema? Okay, there was definitely some overlap in that crowd. Well, in my role as a surgeon, I am always encouraged because I know that lymphedema rates are decreasing because we're doing less surgery on the axilla, but unfortunately, that's not going to help any of you. There's lots of research going on ways to treat lymphedema surgically, but so far we're still trying to optimize that and really get better at that. But as many of you know, the mainstay of treatment for lymphedema is with physical therapy and lymphedema massage and compression garments. And so we want to be here as a resource for you. And so I'm excited to hear what Abbey has to share with us all.
Right. Well, hi, my name is Abby. I am a lymphedema therapist. I'm an OT. I've been with the rehab team with Northside since 2020 in lymphedema specifically. Just a little bit about my background. I am certified by Casley Smith for lymphedema, as well as ILWTI with wound care and lymphedema. And I am a LANA certified therapist. I also hold an oncology rehab certification. I'm excited to get to talk to you guys about lymphedema today. I really believe knowledge is power in this way in terms of prevention. So it's really exciting for me to get to come up here and do this, not just with my own patients who come through the door, but in the community as well. Okay. So when you leave here today, I hope what you learn is a little bit about what the lymphatic system is and what it does for us at baseline. I think it's important to understand what it's supposed to do before we understand what happens when things aren't working well. And then after that, I'd like to have you understand what causes lymphedema and what it looks like. And then what can we do to reduce our risk when we are at stage 0? And then finally, if you end up needing lymphedema treatment, if you present with swelling, then I would hope that you come out of this knowing what treatment looks like and what management can look like, so you feel more empowered to get what you need when you get to that point, or if you get to that point. Okay, so what is the lymphatic system? The lymphatic system is the system that takes fluid from our tissues and brings it back into the bloodstream. When we talk about it, or how I want to kind of progress through what the lymphatic system is, I want to start at a more cellular level, at where the fluid is really coming from, and then progress through what the lymphatic system looks like on a bigger structure. So each of the cells that make up your body needs supplies, food, water, you name it. Those supplies are being pushed out of our blood from our arteries into the tissues. Those cells that make up your body are going to take up what they need and then push out what they don't need, meaning there's a fluid that contains the leftovers. That fluid cannot enter back into your bloodstream on its own. There's a special layer on our blood vessels that prevent it from going back into the bloodstream. And so it's the lymphatic system's job to pick up that fluid, process it, and then eventually dump it back into the bloodstream from our veins. About half of the fluid that enters the lymphatic system enters directly from a lymph node back into a small vein, and the rest of it continues through the rest of our lymphatic system and is dumped up at our necks, actually, at an area called the venous angle. So now that we know how the fluid is going from our tissues and getting into the lymphatic system, I want to talk about what that lymphatic system looks like. So it starts with the lymphatic capillaries, which you can see a picture of at the top over there. Think of it as like a spider web-like network. It is throughout all of your skin in your body. Those lymphatic capillaries have what's called an anchoring filament that attaches to your skin, so that when you stretch your skin, or when swelling stretches your skin, it actually pulls from the skin and opens those initial capillaries, and fluid can flow into your lymph system. So that's how it's going from your tissues into your body. And that's located at the dermis level of your skin, which is just under the top levels. Because those capillaries are attached to our skin, we are able to, with massage, open and kind of optimize lymph flow, which is why MLD is so effective, or can be helpful. And those capillaries are then attached to precollectors, which are those vertical lines coming down. Precollectors are collecting fluid from the capillaries and bringing them to bigger vessels. Pre-collectors are throughout your body. About 3 to 4 centimeters in diameter is what they can drain in most of our body. And then on our palms and our feet, they're about 1.5 centimeters in diameter is the area they drain, which is like less than a dime. So you have a lot of those all throughout your body, collecting fluid and kind of bringing it into those bigger vessels. Now, once you get from the pre-collectors, you get into collectors, which are those bigger vessels you see coming through the deeper layers right there. Collectors have valves on them, meaning at this point, the lymphatic system is flowing fluid in one direction. Before this point, the capillaries have no valves, which means we can move fluid in any direction. Once we hit collectors, the fluid should be flowing in one direction. And then in the collectors, there's those little bulbs, which are called lymphangions, and those have a pulse to them, or they are pumping, so they contract and move fluid. They are pumping fluid at a level of 5 to 8 beats per minute. So think about how much slower that is than your heartbeat. However, when we exercise, we can increase that pumping rate by 5 to 15 times, meaning exercise can be really helpful in moving fluid. Okay. So once we get into the collectors, we can get into the bigger vessels, and eventually we kind of collect the fluid into these lymphatic trunks. The two main lymphatic trunks that your body kind of ends the lymphatic system in are the thoracic duct and the right lymphatic duct. So those are the biggest vessels for the lymphatic system in our body. If you look at the picture on the far side over there, the green shows what the thoracic duct is draining for your body from the superficial standpoint of the lymphatic system. And then the yellow is what the right lymphatic duct is draining. So about a 75-25 split. And those vessels end at the venous angle, which is the junction between your internal jugular vein and subclavian vein. So they just dump directly into the vein at the very end. There are about 600 lymph nodes throughout your body. And along the way, again, those lymph nodes are processing fluid, dumping part of the fluid directly into the smaller veins, but eventually about half the fluid ends up at the end of your lymphatic system. And we process about 8 liters of fluid through our lymphatic system in this way every day. 4 liters through the lymph nodes and 4 liters make it to the end of the lymphatic system. Okay. I think as like lymphedema therapists, most of what we talk about is fluid movement through the lymphatic system. I do like to talk about its other function, which is an immune surveillance function, because it does impact our patients. And I think it's also just important to know the purpose of our lymphatic system. So in the lymphatic system, there are migratory immune cells that are providing immune surveillance. We also know that when we have breakdown in the lymphatic system, there's an increased risk for infection, or it's more likely to see infection in those areas, which just goes to show that the lymphatic system isn't working as well and the immune surveillance is not happening as well. And then I think not from a lymphatic standpoint, but again, just to show its global purpose, there are some more recent studies connecting some more autoimmune conditions or like IBS and Crohn's disease to lymphatic dysfunction, which again just shows that it is kind of widespread and important in the way it helps us function day to day. And then that picture, I put it on there. It's an example of cellulitis, which is just an infection in the limb. It is hard because everyone's limb presents differently when they have lymphedema. So those classic signs of like pain, redness, heat, swelling that we would expect with an infection apply. However, if this patient's leg were like that chronically and there was no other conditions or concerns, it may be that he just has hemosiderin staining or staining from lymphatic dysfunction, and that could be his baseline. So really, I think what's important is know you're normal, and then if you notice you wake up one day and you had lymphedema and you wake up and there's heat, there's pain, there's redness, those are times that you go see your doctor, right? So know you're normal, know your baseline, and kind of go from there. Okay, so now that we've talked a little bit about what the lymphatic system does, I want to talk about what lymphedema is. So lymphedema is the accumulation of excess fluid in the tissues due to damage of the lymphatic system, which leads to swelling. Lymphedema is a chronic progressive condition, and there is no cure for lymphedema, so it requires consistent lifelong management. I do like to note when I'm talking about what lymphedema is, because it is a frequent question for me, is the difference between edema and lymphedema. And I have to say I'm biased in the way I respond to this question as a lymphedema therapist. So when we have fluid in our tissues, we know that it's the lymphatic system's job to move that fluid. And if we are not moving that fluid well, then I'm going to argue that it is the burden of the lymphatic system. Now, I'm not saying if I sprain my ankle right here, right now, and I end up with fluid in my ankle that I have lymphedema, but if my body were unable to reasonably clear that in an inflammatory phase of healing, if I'm not clearing that fluid on my own, then there's something going on from a lymphatic perspective that's not allowing that clearing. So in that way, we kind of argue that all edema is a lymphedema. Now, whether it's a chronic condition is another thing, and how we manage that could be different. Okay, so we do stage lymphedema, or consider it to be a staged condition. We put 4 stages, 0 through 3. Stage 0 is knowing that there is lymphatic damage or lymphatic changes, but there's no external presentation of swelling or buildup of fluid. So when we think of what a stage 0 is, we really talk about that in the cancer community. I've had to have some lymph nodes removed, but from my armpit, but my arm is not swollen. I'm not having any issues with that. I have a risk of developing fluid because I know that my lymphatic system isn't at 100% capacity of what it used to do. Stage 1 means that you are having fluid or swelling come, but that it can be 100% reduced with elevation. So this might be, I've been on my feet all day. Wow, my ankles are swollen. I go back to bed. I sleep in my bed at night, and I wake up and my ankles are 100% normal again. This would be a stage 1, meaning you can completely make the fluid go away. I do have patients who come in and believe that they are stage 1. They say that their fluid goes all the way away, but because swelling can happen so slowly and chronically, sometimes they're not recognizing the slow changes in their legs as not being back to baseline. So it is a tricky in terms of staging to know whether you are really a stage 1. And then at that point, if we're not getting all the way back to baseline, we consider it a stage 2. So stage 2 is swelling that does not go away completely with elevation. At this point, we might be starting to see some changes in the tissue. You might be having some fibrosis or firmness developing. This is a really large range between mild stage 1 and like more progressed stage 1. It really encompasses a lot of people in our in the lymphedema world. It's a very large range. And then stage 3 used to be referred to more frequently, or some people know it as elephantiasis. At this point, it's really just noting that there's a significant visible difference between the limbs. You might have skin involvement or wounds present or skin changes. There's significant fibrosis and thickening of the skin. And so really it's just noting like a significant change from baseline. For the purpose of moving into this talk, I will say I'm going to talk about lymphedema not as a stage 0 because we know we're trying to prevent from there, but more as that progressed condition. So when we talk about developing lymphedema, we'll probably talk about it more in that 1, 2, and 3 just for simplicity. I also like to note when we read research in the lymphedema world, it is not well documented about the incidence rate in the oncology population because we don't stage it very equally across research. So how we diagnose and look at that in research isn't super consistent. And for that reason, the incidence rate for lymphedema across different cancers and across different studies ranges from 5% incidence rate to 83% incidence rate. And I think what that really shows is that how we diagnose it, whether we're considering a stage 0 to be a lymphedema case or a stage 1, or if it's progressed and we're saying a stage 2 is a lymphedema case, is probably just not really consistent in research. Okay, so what causes lymphedema to happen? When we are thinking about lymphatic breakdown, we kind of categorize it into a couple different categories to make it easier to understand what's going on. And the first way we do that is calling it dynamic insufficiency versus mechanical insufficiency. So dynamic insufficiency means that my lymph system is being overloaded by more fluid than my body would typically move. And that overload or overworking of the lymphatic system leads to breakdown. And then I develop lymphedema because I'm not keeping up, and it kind of tires out the lymph system. Mechanical insufficiency means my body is still producing a level amount of fluid in those tissues, but I have a trauma or breakdown in the lymphatic system itself, and I no longer can keep up with that level of fluid that would be typical for my body. You can also have a mix, meaning you have a little bit of both. I like to kind of describe this as a boat. So if I have a leak in my boat, but I can scoop the water out with a bucket, no problem, and I can keep myself stable, that would be good, right? Now, dynamic insufficiency would be if the hole in my boat just got a lot bigger. Water is rushing in quicker, and even though I'm going as fast as I can with my bucket, the boat is filling up, right? The level of flow in is too much for the system present to handle. Mechanical insufficiency would be if the bucket broke. So the change in the leak into the boat has not changed, but my bucket is not scooping water. It has a hole in it. So every time I scoop, I'm not getting the water out that I should. That would be the system breaking down. And what happens a lot of times is that you might have a hole in the bucket and a hole in the boat. And that's the issue, is that you have a little bit of both. The other way that we talk about lymphedema is primary versus secondary. So primary is those conditions of people who were born with this condition. It can be a genetic or something that happens as the baby is forming, where their lymphatic system doesn't work as well. Primary is considered a mechanical insufficiency. So the lymphatic system just never formed the way it should. It is not what we talk about in the cancer community a lot. However, I do think that some people have a predisposition to lymphedema, and their cancer treatment just kind of creates a flare up that really makes it notable. And then secondary is I had a 100% functioning lymphatic system. Something happened to make it break down along the way. It can be dynamic or mechanical in nature. Okay, so what are some risk factors from lymphedema? What could make me develop lymphedema, or what is my risk if I've gone through treatment? That might be something we get asked a lot. So things that matter is the number of lymph nodes being removed, the amount of surgery that happens. So the reason we ask about types of surgery or number of surgeries is when we have incisions in our skin or in our tissues, we kind of think of it as a wall in typical lymph flow. So if we have a scar line, it can make it a little bit harder for fluid to clear or slow things down. The other thing to consider is tumors themselves can push on the lymphatic system and create swelling. So that can be a reason you develop swelling. And then another risk factor in terms of like cancer treatment that we ask our patients about is seromas. There is some evidence that states if you have more seromas, or you have to get like more drained seromas, or which is like a pocket of fluid, you are more likely to develop lymphedema. And from that standpoint, I'm not sure if that would possibly mean that you're just already having a harder time clearing fluid. But the way the research really writes it is that seromas, being like multiple seromas, is linked to higher risk for lymphedema. And then outside of, here's what we expect directly from cancer treatment. A lot of our patients present to clinic and have lymphedema not related to their cancer treatment, but they have this cancer history that really brought them to us in the first place. And I like to go over those reasons that you might get lymphedema otherwise. A lot of those are vascular problems. So a history of blood clots, venous insufficiency, cardiac conditions, and then kidney disease, liver disease. These are things that can create dynamic insufficiency. So they can cause an overload of fluid into the lymphatic system. So I'm supposed to be moving 8, and my body is asking that I move 9 liters of fluid. The overload of those systems can be causing the lymphedema. Now, when we see our patients, we do ask that they're at a managed state from a medical standpoint, but it doesn't mean that because there's an underlying cause, we can't also help the lymphedema. Another thing that is a risk factor for lymphedema is risks of infection. So if you've had an infection, you would be more at risk for lymphedema because that overloads those tissues. And then I'm also going to argue a lot of our patients note that that infection was the cause of their lymphedema, but I think it was actually just an exacerbation of their lymphedema, and that they were already presenting with fluid and it flared it to a point where it was unmanageable. Trauma, so just blunt trauma to your lymphatic system. If you have a crushing injury, that could damage lymphatics directly. And then, like we talked about, those primary conditions, congenital conditions of the lymphatic system that don't work well. And then obesity is considered a risk factor for increasing your risk for lymphedema. I do want to talk about obesity a little bit, though, because a lot of our patients who have come in from a chronic state of lymphedema and tell us they've been having swelling issues for 20 years, we ask management, some of them have been told, well, you need to lose weight, or they thought I just needed to lose weight. And I think that can be a harmful barrier for treatment. Yes, it can flare your lymphedema or make it harder to manage if you're having a hard time managing weight. And it can cause lymphedema with a BMI above 50. But no matter those factors, you can still control other factors in your health. So I don't want weight to ever be a barrier for a patient seeking to manage their condition. So I put it on these lists with a caveat that we need to talk about that and not let it be a barrier to care. Okay, so what does lymphedema look like? How would I know if I'm presenting? The most obvious is obviously signs of swelling. So is your arm or leg or any area of your body getting bigger? Is it swollen? If I push in, do I leave a mark like that top picture? They're pushing in, it leaves that pitting mark. Those are classic signs of a lot of swelling. Other things that patients with lymphedema note are heaviness in the affected area, skin tightness, sensation changes, discomfort or aching in the area of the lymphedema concern, skin thickening, and changes in movement. What's difficult about all of these signs and symptoms is they can be caused by a lot of different things and might not necessarily be caused by swelling. But if you're kind of looking at how you're feeling and noticing these changes, it never hurts to ask a provider to screen you and see where you're at with things. This list is not exhaustive of the signs and symptoms of lymphedema, but I do think it's a good starting point to note. And some people will just know over time, like the sleeve of their shirt feels tight. Those are, things that people maybe notice more. I think the best thing you can do is know you're normal. And from there, if you're having issues or you're having concerns functionally or from like a just visual standpoint, it's worth asking. Okay. So I want to go over what evaluation day might look like if you find yourself coming in for an evaluation for lymphedema treatment. So the first thing we're going to do is ask you some medical background. We want to know what the risk was that kind of led to this lymphedema occurring, and know kind of how many risk factors you carry to just give us an idea of where things are at and what we might expect in terms of your reduction. We're going to take baseline volumes measurements. So that's just circumferential measurements that we calculate a volume roughly of your leg with. We're going to check your range and strength in the area of concern, possibly depending on if it's important to that specific case. The LLIS is just a screening tool we use to ask our patients to rate how they feel their lymphedema or swelling is impacting them. So it's a common tool used in the lymphedema world. And then after I get that kind of background information, the big thing we ask is an occupational profile. So we want to know what you do in your day, what roles and responsibilities are important to you. And we are nosy, but that's not why we ask. It really gives us an idea of what you need to be able to do and how treatment might impact you and what your goals will be in therapy. And so an example of that is if you are having a hard time getting up and out of the bed in the mornings. So you're having a hard time getting your legs in the bed, you're having a hard time getting your legs out of the bed. And then I wrap your legs and you now cannot get your legs in the bed. I need to be aware of those things that are already hard so that I can make sure that we're making a plan for success. And that's the same reason we ask about your environment, where you kind of live most often, your house, your work, things like that. If you walk to work every day and you're having a hard time getting up the stairs at work, and then I wrap your legs and you're having a really hard time getting up the stairs at work, that is something I need to be aware of when I'm choosing your treatment plan. So it's just kind of giving us the biggest picture to give you the most success, both in treatment and in long term. And then after we get all of this background information, we do want to start some sort of intervention on the day of an evaluation if we have time. Now, this is somewhere where I think we disappoint our patients a lot, because a lot of them are like, are you going to wrap me today? Are you going to massage today? And the answer most of the time is no, which is disappointing, but I want to say why we do this. It's because if we don't start setting the basis for creating a plan for you to manage your condition and understand how you're going to manage it long term, then we're doing you a disservice. So if I were to get your swelling out, but not have a plan for when you discharge that you can manage that swelling on your own, then I've failed you as a therapist. I haven't set you up for success. So our initial visit is really focused on making a plan for how we're going to attack your condition and how we're going to be successful in managing that together. Other things that might happen is we might talk about getting prescriptions signed for compression, which would be asking your physician what their thoughts are on and signing a prescription for that. Talking about like how you would reach out to get compression garments when the time is right, and starting a home program of decongestive exercises that you can then continue long term. So we really are setting the foundation on day one. So I want to talk about what the components of lymphedema management look like. Number one, I'm going to say I put these somewhat in an order of what I value as a therapist. We all value things differently, and I will explain why I value them in this order somewhat. I put compression as number one for my patients. And the reason is when you look at the research, what it says the number one driving factor of successful lymphedema management is compression. So if that is the number one factor, I want to both make sure that it's a big part of your decongestive plan and your long-term plan. And then the second one I put is exercise. We know that the lymphatic system pumps better with exercise. And when we look at lymphedema treatment, they've done research where they've done compression, exercise, and massage, and then just compression and exercise. What they found at the end of that research is that adding massage in did not create any more volume reduction. Now, I'm not saying it's not an important part of lymphedema management. I'm just saying I'm going to push for exercise that packs the biggest punch and compression before I push for self-massage on a daily basis. And then skincare is kind of in between there. And the reason it kind of snuck in between is because we know the lymphatic system and the skin are really interdependent. When we have breakdown in one, we can have breakdown in the other. And especially with infection risk, it's important. Now, for a lot of our stage 2 patients, this is just general skin health. We might go over, avoiding like scents and dyes and what kind of detergents to use, like some smaller things that are easier changes in your life. But skincare is going to become a lot more important for patients who present with wounds. And then it's going to be a more urgent concern. So it'll push up in the hierarchy of what's important if we're in that kind of stage of things. And then, like we talked about, manual lymphatic drainage. In my personal practice, because of where it sits in research, I do use it as a preparatory activity to help with lymph flow. I definitely use it to address fibrosis changes that are present with lymphedema, and also skin changes, because we know that if your skin is thickened and hardened and we're not able to get as good of skin stretch, then we know we're not using our initial capillaries as well, because they are attached. I'm just not asking my patients typically to do like an hour-long massage, self-massage every day. I really put the emphasis on a home program of using decongestive exercises since it packs the bigger punch. And then I put other. There are other things that we do to manage lymphedema, and I'm going to say that they're more adjunct. They're added to your primary or your core care. I do think they're worth talking about. The first one I'm going to talk about is the pump, which is what you see in the picture here. So it provides compression by filling up with air, and sequentially up his leg, it's going to provide pressure to help pump the fluid out of his leg. The research on pumps is really mixed. Some of it is good, some of it is that it's harmful, and some of it is that it did nothing. And it is one of those things that the best research on it, or the most positive research on it, is funded by the people who make the pumps, which makes me skeptical. I am skeptical in that way. So it is one of those things that we use more as on a specific case. It is not something most of our patients end up using on a daily basis. We do say if you would like a pump, or you think it might add benefit to your care and you seek out getting a pump, that you need to be doing the top priority things and adding it in rather than replacing something more important with it. Another treatment option that I do like to talk about, and I do use some, is KT tape. So kinesio tape is a flexible, stretchy tape that you can apply. It is used for like musculoskeletal conditions as well, but I use it in lymphedema to help with fluid movement. Research on it is a little bit lower in terms of effectiveness, and it's not something that could replace compression. However, I found it to be helpful with certain conditions that are harder to get really good compression on: head and neck swelling, breast swelling, things like that. And anecdotally, I have had some good success with that as an addition to care. The other thing that has come up more frequently recently, patients asking about, is vibration plates. And that is something I think people see on Instagram a lot, honestly. And they ask about vibration. Does not have really great, especially vibration plates, does not have really great research behind it for lymphatic movement. There's just not a body of evidence behind it. It is used with like neuromuscular conditions and helping facilitate muscle use. It is proven to help with vasodilation, and it is proven to help with muscle activation. However, I'm going to argue that if we're looking for muscle activation to help our swelling, we should be going for a walk. It doesn't mean that you can't use it. It just means it should be an add, not a swap from your other care options. Kinesio tape, or KT tape. Yeah, and there are other brands of it. But most of the research you'll find it called KT tape. Okay. So when we bandage our patients, which is what we do to move fluid for decongestion, we call it multi-layer bandaging. We put a layer on that is like a stocking layer to protect your skin. There's padding layers. There's also texture in there, depending on fibrosis, or if we're trying to channel fluid around an area, we use texture sometimes to do that. And then there's a compression layer that goes on in multiple layers. We use short stretch bandages for that. When we are thinking about why we do what we do as therapists, the kind of theoretical basis or thought process is called the law of Laplace. And basically all it is saying is how we create tension for moving fluid matters, and the things that impact pressure or tension inside the bandage is the circumference of the limb. So how large around the area we're wrapping is, the tension I pull the bandages, the number of bandages I use, and the width of the bandage all impact how I'm creating pressure, and are things we keep in mind when we're creating a pattern for a patient for decongestion. Okay, so exercise as a treatment. The theoretical background to this is called Pascal's law, which basically says when we are in compression and there's fluid and we create a force in there, we are creating the force in the entire container. So if compression is a container on our limb and I contract my muscle to create pressure, that is also creating pressure on our lymphatic system, which allows us to better stimulate it and make it pump faster. So if you look at this person doing a squat, in position B, he's able to actually pump his lymph nodes at his inguinal lymph nodes, which are up at his hip, by creating pressure into that squat, which allows the lymph nodes to be stimulated. He's also activating quad and glute. Those muscles are firing and helping pump the lymphatics around them. And then if you have tight calves like me, when you're in that B position, you're also creating stretch down the posterior side of your leg. And that can help create skin stretch, which would then help open initial capillaries. Those are just an example of how exercise can help create lymph flow for us. Okay, so manual lymphatic drainage. We use a combination of deep pressure at lymph nodes and skin stretch to help move fluid. This just helps us optimize lymphatic flow through an area. We do use other areas of drainage. So if you look at this picture, those red lines are breaking up typical drainage areas and where lymph fluid flows. So if we're noticing that we have a traffic jam of fluid on this side, we're going to push it across and hope that it takes into another area of drainage, just so that we are not overloading the area that is already having a hard time. Again, MLD has that research that says definitely we know that we can make the lymph system pump flower faster with manual stimulation, but we also know what the outcomes of that is in terms of volume movement might not be what we hope. So we use it, but we want to make sure we're using the other options that we have for lymphedema treatment as well. Okay, so when we think about managing and treating lymphedema, we consider it to be kind of a two-phase thing. The decongestive phase means that we are getting the fluid out and getting you back to a baseline that we can establish. The maintenance phase is what you are going to do to maintain the reduction you receive in that more therapeutic area of decongestion. Exercise and MLD and those kind of added treatments are going to stay stable across that continuum of care. So you're going to do exercise and bandages. You're going to do exercise in your compression garments long term. And those things are going to help manage you. The thing that does change is the type of compression we use. So on this side over here, we have things that might help with reduction, moving fluid. And the other side is things we use more for maintenance. The top picture right here shows the bandaging, which really is the gold standard of moving fluid. It is what we use most frequently and what we recommend most frequently in treatment. The bottom here shows an example of a Velcro garment. They are rated and help move fluid. I think in practice, I found that they tend to move fluid a little bit less and be a little bit less comfortable. I also think that part of that is that accountability component. When I put my patient in a bandage and they come back in it, they can't cheat and take it off, but they can cheat a little bit and take their Velcros off. And I don't blame you. They're not comfortable. It's an adjustment, but patients do adjust and they actually find that they learn to love their compression because it keeps them in a more comfortable state overall. Long-term garments look a little bit different. That top picture is an example of day wear. So it's more the thickness of a sock, and it's really meant to maintain you once you've reduced. So we ask that you get measured for those garments when you've already had your reduction done, because we want to maintain you at the reduced state. And the bottom picture is an example of a nightwear compression garment. We don't want to wear day wear compression to sleep in. It's not as safe for our arteries and veins. But if you're at a point in your care where you need nightwear, there is a garment or types of garments that help with that. And although it is the bulkier of the garments, people actually find them to be pretty comfortable overall. Most people don't complain about the way it feels. It tends to be a kind of a pillowy hug. Okay, so when I'm talking about treatment or decongestion, a lot of my people on day one want to know, what does that look like for me? What is it going to take to get reduction? At baseline, I see most of my patients 3 times a week as a majority. That means that you're coming in, I'm bandaging you, you're living in those bandages, and when you come back, we're going to do it all over again. That does not mean all of my patients have to come 3 times a week. My stage 0 definitely don't come that frequently. Stage 1 don't come that frequently. And then there are cases that are more severe that might need to come more frequently to get the success level that they can really achieve. People ask, how long do I have to do this? But there's so many factors in that. So how you present, how your swelling presents, how quickly it refills, how much scarring or fibrosis buildup you have matters. And then the other more practical factors, how quickly will the garments you need come in, because there's supply chain issues and you have to get all of these garments as well for management. So there's so many factors in managing it, but this is what I would say. If you can get through this initial phase and get into a maintenance phase, maintaining a maintenance phase where you know what you need can be a little bit easier. So if you can be patient and push through, I think people really find that is worth it in the end. And then in terms of discharge, almost always there's going to be a plan for compression, a plan for exercise, and then depending on how you present, we might have some other things you need. Do you need to use MOD more as like a tune-up in between? Do you need to use kinesio tape on a weekly basis, which some of my patients have had to do that just to kind of keep things under control more in their trunk or head and neck areas. So what else do we need to be adding in to keep you at a maintained phase so you don't have to come back into the bandaging phase? And also so that you aren't feeling the heaviness and can kind of do what you want to do in your day. Okay, so for Northside Rehab, these are the locations that Northside has outpatient rehab. Not all of these locations have lymphedema therapists in them, and I'm not sure on the other campuses. I will say in the Atlanta campus, Atlanta, Sandy Springs, and Alpharetta, we both have several lymphedema therapists, and the medical tower location does not have lymphedema therapists present. But if you find yourself needing care, this is something that the rehab department could help you schedule into the appropriate location. Thank you so much for your time and letting me talk about lymphedema. I hope it was helpful and just giving you the background that you need to be able to know if you develop lymphedema or what to do if you have a risk for lymphedema.
You want to point out too that Abbey brought some handouts. Abbey brought some handouts for everybody. I'm going to put them back over here. So if you guys want to grab some, she brought some great information along for you to grab. Now we could do a Q&A with Dr. Barnes and Abbey if they want to both come up here, and we could do some Q&A. Any questions for Dr. Barnes or Abbey about some of the information shared? And you might have to pass this, sorry. Go ahead.
So I overheard you say that lymphedema is caused by mechanical or natural. What do you mean by mechanical?
So if you think of your lymphatic system as like a pump,
Yes.
so it's pumping something out, there can be a mechanical breakdown, meaning the pump isn't working the way it should. What that could mean is that the capillaries, it could be anywhere in your lymphatic system, the capillaries aren't opening to let fluid in. It could mean that there is fibrosis around the bigger vessels that doesn't allow them to move fluid effectively. Mechanical is just saying overall there's a breakdown in the system itself, whereas dynamic means I overloaded that system and it got tired.
Yes, because I had
Uh-huh.
allergic reaction from contrast.
Mm-hmm.
And as you say, elevation is the key. I had to sleep sitting up 4 months. I need to go down.
Oh my goodness. I'm sorry to hear that. That is really hard. Yeah, I'm sorry to hear that.
Question on future treating lymphedema. Is there any research into
No, not really, because it's kind of like I think it's also for the people online. So the question was, is there any research into draining the fluid off? It's like trying to take an extremely fine sponge and there's not a place to stick a needle in to evacuate the fluid. It's not a pocket of fluid. It's a wet blob. It's the whole system. So the research is mostly in things like, are there surgical interventions to transfer lymph nodes? And there is more research on upfront preventing lymphedema by trying to recreate some of those connections that are lost when the lymph nodes are removed. And so that's been the focus of the research to date. And some of those anastomoses that are made preventatively are somewhat helpful. And I think it's only at major research centers that they're really doing a lot of those transfers, and they're not covered by insurance also. So it's just troublesome. And to be frank, like it's not just an insurance problem. There's a lot of conflicting data. Like, does it even help?
And then On that note, in terms of like our patients who might end up with really severe swelling and they're finding it's limiting the way they move, there are like times when like a SAPL or a suction assisted protein lipectomy where they try to prevent damage to the lymphatics and move tissue out to just give patients relief from the amount of buildup. But the thing is, after you do that, it's not stopping the lymphedema from coming back. The underlying condition is still present, and you have to get on a management plan from those surgeries as well. And that's really for like progressed cases that it's impacting how you're moving and doing your day. The goal is to prevent so we don't end up at that level.
Is it possible for lymphedema to cause pain in the neck, shoulder, and even up towards the ear?
Yeah. Yeah. So like I'm always careful when I answer these questions because it can be caused by so many things. But if you're having heaviness in your limb, I think one, even just a small increase in weight, we are going to feel, we call it a kinetic chain, right? So each muscle in each area that's pulled, you feel it up through your body. So a lot of times with people who have arm swelling, we end up doing some work up into their shoulder and up their neck because of that pain. I also think that some people have more pain with lymphedema and some people don't have pain with lymphedema. So that's hard, but could it be something else? Yes. But could it also be from the lymphedema? Yes. Yeah, I'm sorry.
Okay, I think you might have already touched about this, but I wanted to ask about kind of more other surgical options. I've had a lymphedema therapist suggest perhaps like liposuction of fibrotic tissue or things of that nature. I guess I'm not clear on
What that would do for you?
what that does, and does it overall sort of solve any lymphedema related
Yeah.
issues?
I don't know anything about that.
I'm like a surgeon. Yes. Yeah.
Life saving liposuction.
Yeah. We call them, yeah. There's like a couple different names out there, but that's what the SAPL is. It's doctors who, and it's usually in the vascular world. So it's doctors who have specialized in these techniques where it is basically like a liposuction thing, but they're trying to prevent damage to the lymphatics. And it is removing tissue buildup. So it can remove some of the fibrotic buildup and just like with lymphedema, we don't keep it fluid. Like it doesn't stay fluid on your body long term. Your body says something's not right here and it starts to build up tissue. Sometimes that tissue is adipose tissue. Sometimes it's more of this fibrotic tissue. And so those techniques, those surgical techniques are used to remove the tissue buildup. Now, here's the thing is it does not change your lymphedema. It does not change the breakdown of the lymphatic system. So the minute you come out of surgery, you should be on a compression plan. And we do see some patients post-surgery. The best of those cases are come from like surgical areas where they have really strict lymphedema guidelines coming out of there. So they're measuring patients for garments on the table before the patient wakes up. They're getting in those garments and they have strict protocols on what they wear and when they wear it, and then reducing those patients again. So it's one of those things of, yes, it's out there. It is another surgery. So it is, there's risks and benefits to all of those things. But we have had patients go through that process and it doesn't change the long-term management. What it does change is the heaviness of the limb, the function.
It sounds like it kind of gives the opportunity for a reset to start over with trying to
manage
really effectively.
Yes,
manage.
I think that's a good way to put it. Yeah.
Although I think the issue also is that they're, like you mentioned, only the larger surgical centers seems to do it, like Cleveland and MD Anderson, Houston. I think there's very general, very limited research shows that there's, I think, one doctor.
I want to say, I think we've gotten either 2 or 3. Now I'm not good. I don't know. I could not name them right now, but I think we get 2 or 3 in Atlanta. Now we do have people who have traveled, like who live in Atlanta, who have traveled to these bigger surgical centers and then come with lymphedema protocols, and they're basically transitioning care from there back home, which is obviously very involved for their care. That's a big commitment. Yes.
I got emotional, but I'm back. So I have fluid in my ear and in my lymph nodes. I can, like, it wakes me up. It's like, ugh.
This is a hard one. So like you can get congestion in there, like they show MLD techniques for like clearing the ear. And you do have lymph nodes around here. The thing is, like in terms of like really internal structures, as lymphedema therapists, we're really focusing on the majority of the lymphatic system, that 70% that's it's in the limbs and the tissues. So it's more skin level. It doesn't mean that there isn't something going on there. It's just harder to get. Now we do decongestion in the head and neck.
They did do the drain.
Yeah.
Because I had 6 lymph nodes removed from under my arm,
Mhm.
breast cancer. I had endometriosis and breast cancer at the same time. So they did do the white growth also. So it's like, again with the allergic reaction to the contrast, and it interfered with my vena cava vein. It was just a mess, a nightmare. But I'm here, and I'm still working on it.
That's the important thing.
Lymphatic massage help, because I do walk.
Yeah, I think so. It's a tricky one. I think that if you have a chronic condition, compression is always where we start, but it depends on the condition. So my head and neck patients, do they wear compression? Yes. Is it harder to wear compression in the day? Yes. So a lot of times they do end up using self-massage on a regular basis to kind of help optimize. So what we do is we teach those techniques. So we use it in session, but we're also saying we want this to be a long-term solution. So if MLD is part of the solution, we want you to be able to do it to yourself. That's the goal. That is, if you get an order from your doctor, you talk to your doctor, you can come into rehab and ask for lymphedema therapy. We look forward to seeing you.
Yes, ma'am. So I heard you say that lymphedema is there's no cure, but is there rehab, like where
Absolutely
disrupted, like physical therapy? I mean, in physical therapy, but like beyond that, is there some kind of reset for my actual system?
I mean, that I think Abbey is a physical therapist, lymphedema therapist. So
Yeah. So what we do is we say, okay, this limb has swelling in it. We need to get it down to reset it to get you into maintenance phase. So therapy is where we get the fluid out because we can move fluid.
Thank you.
yes, ma'am.
In the world of fitness and prevention, there are a lot of times when I have to do the hot or cold after a workout, and I'm just not sure if I'm applying heat or cold in a way that will mess up potentially.
That's a good question. So we know that heat and cold, like the extremes, can slow lymph flow. And so we say use them with caution. So a lot of times they'll be like, don't get in the hot tub, right? Because that's a lot of heat on your body. However, in terms of prevention, I would say like it's a risk and benefit, right? So if it's making you feel better, if it's letting you move better, I wouldn't necessarily rule it out as an option. If someone has a lot of swelling, then I'm going to probably recommend that they avoid using heat regularly. But those are more like progressed conditions, progressed cases.
So I have a question. Patients that have lymphedema and let's say they are put on steroids, how is your treatment different for their continued plan? So they have lymphedema, they're being managed, and when you put on steroids, and you know what happens.
So with like from my standpoint, and this isn't just true for like one condition or another. I was actually talking about steroids with a patient today. There are things that are going to need to happen in treatment that are going to lead to swelling, and we are going to accept that because for our overall health, it is necessary, and we're going to manage our condition the best we can. And when those treatments are finished, we know what we might need to reduce again. So this is true like throughout cancer treatment, depending on when you're in lymphedema. And it's also true for like long-term management if you end up on a medication that causes swelling. So it's really about like managing it the best we can in those stages and then helping get back to a baseline. And that is not black and white. Like we have these regimens of how we manage decongestion, but we also know that realistically, lymphedema is not the only thing going on, and we need to back up or be more aggressive in treatment depending on what's going on. I don't know if that answered your question.
Yes, but it didn't help my situation.
Yeah.
I can't get back on that original baseline. It's ridiculous.
Yeah. Do you feel like it's one area, I guess would be my question?
And I just came to the wellness center. I'm on post with Shikra. She's awesome. So no. Yes. And so I went home with a bunch of tools. I have 5 new tools.
I would say
I
like,
feel like one of the tools I've definitely felt like I need to go get measured, but I felt like it's gone down a little bit. I used all the tricks which I've had this for 8 years. So, but I got steroids the second time around, and it just like went crazy. Yeah, I was the elephant.
so if you're having a hard time getting it into like a manage, then I'd say it's probably time to come into therapy. Because like when I say is it's a chronic condition, you have it for a lifetime. But if you're having a flare up that's hard to manage with garments, then it might be time to come back and like reassess and do a little bit to try to get fluid moved. Now we don't like, I like my coworkers joke that I'm the worst because I'm like, I'm not promising anything here. Like, I don't know what reduction will look like, but I do think that is your best chance of trying to get it managed the best you can. That's what we really are focusing on is reduction to hopefully then get you at a point where you can manage it yourself again. So I'd say if there's concerns and you're not sure that you're really at a best managed state, it might be time to talk to your doctor about whether it's appropriate to come back to therapy.
I have a question. My question is, my body holds a lot of hormones, and I've had 3 or 4 removed. Now on my left side, my lymphatic system is blocked, swelling. I got like pockets of fluid here and here and there. So my question is, when I go to the doctor and ask them about it, they see, but they don't understand. So maybe I need to go to a specialist like you are to diagnose my case, what can be done in that area.
I'm just one of those doctors who doesn't understand. Yeah, that sounds very there. Is it fluid building up in the spaces where the lipomas came out?
That's a good question.
Well, I had a couple of them was removed and then they shift. And now with them shifting, this whole left side is just swelling.
So
it's just not pockets of fluid, it's edema, it's swelling over.
Right, just a lot of, but I asked a doctor, was it lymphedema? And he tells me to put my clothes on, come back with take me and measure my legs and say, oh, this leg is a little bigger than that one. But when I'm looking, it's just pockets of fluid in the whole left side.
So
I'm trying to get an answer. Where do I go to get the help? Because I'm getting frustrated.
Frustrating, yeah. So this is like, I'm like a little bit, I want to be careful with how I say this. There, I think, are like so many specialties in medicine. So like I can only answer questions about lymphedema, right? That's what I do most of my day. And I think that's going to be true across the medical field. So if you go to someone and you're having issues with swelling and they're like not really sure what to do about it, in this case, I think it would be okay and say, you know, I think I might be having some lymphedema. Can I go get assessed? Would you mind writing me a therapy order for lymphedema? And like, I think it's okay to advocate and ask a physician those questions. If you have, you know, the background knowledge and saying like, I don't know, I think this might be what it is. Can I go see someone who might know a little bit more? And in that way, like I tell my patients, you know, when you have lymphedema that you're more at risk for infections, but if you go into an urgent care, they might not understand the risk. And it's going to be you telling them, I have lymphedema. I'm concerned about my increased infection risk. I think I might have an infection. Can you check? Or, you go in and you're getting a shot and the doctor's like, I want to use your left arm. No, I have a risk for lymphedema. I need to use my other arm. It might take a little bit more like self-advocacy to make those things happen, because we only know what we know. And when you're walking in, they only are aware of what's right in front of them in that moment, So it might be a little bit more just like a conversation.
So is there a definite diagnosis for lymphedema, or my question is related to the insurance? Like, if you're not diagnosed and we go to you, is the insurance gonna cover it or not?
So I'm actually in terms of like coming to therapy, the diagnosis is not as important. Like we see like breast cancer diagnoses, but we're seeing them for lymphedema. Now, where it gets tricky with insurance is like compression garments, and that is important that you have a lymphedema code. But when I write an eval, what I'm doing is I'm saying, okay, this is what I'm seeing the patient for. I'm going to put an I-89.0 code, which is just a general lymphedema code. And then I'm sending back to the doctor for their review. So as an OT, I always work under like orders of a doctor, and they're signing off on those orders. And in that way, like your doctor is going to provide that diagnosis. I don't think it's like you have to go get testing. That's not how in America or in this region we really treat lymphedema. It's more of a rule out diagnosis. There are ways to look at the lymphatic system in imaging. It just doesn't usually happen, or I don't see patients with those imaging techniques.
So do we need a referral from who to come to you to get that baseline?
So in terms of if you think you have lymphedema and you need treatment, or you have stage there and you feel like you need to have an understanding of how to manage your risk and you want to come to therapy, a nurse practitioner, a doctor, or a PA can all write orders for therapy. And you just need to specify like lymphedema therapy if you're looking for that.
And yes, ma'am, in the back.
I've been diagnosed with it on my left side and after breast cancer. When I'm away, I go on vacation, I do a lot of walking. So when's the best time for it? Because it gets pretty hot where I go. So when's the best time? Is it to sleep in it, or just in the evening? I mean, it seems like it'd be more of a preventative.
The best time to wear the garment?
Wear the garments, correct.
So there are different kinds of garments. So I think the goal with most of the standard compression garments is at least 12 hours a day. And then, but you should not sleep in a daytime garment because it's too much pressure and you can really cause injury to your extremity.
Okay, so I do have garments, but I don't know if they're day or night. If they're daytime.
And in that case, I would hazard a guess that they're daytime. The standard garments are daytime garments, and they just have higher pressure because you're using your arm, and so it's, and it's hanging down until you're aware of what's happening. But while you're asleep, it can get too much tension on your arm and can really injure you.
Right.
Miss it entirely.
All right.
Yeah, and in that way, I would say, like for most cases, we start with day wear because that is the time that you're most at risk for swelling, for arm and leg swelling, especially.
And not only that, but that's covered by insurance typically. And the night garments are generally not, is my understanding.
I can speak to Medicare. Insurance is really tricky, so yeah, thank you. They actually provide us a lot of information on that, but Medicare does cover night garments, just at a different number per year. Yeah.
Yes, sir.
Yeah, and you know the daytime
Like, what do they look like? Do you guys have?
I got a vehicle, and then I started out with the like the baby wrap, and all the different ones. Get it moved here. We want to take
Which ones for sleeping in?
He's trying to determine which ones he can't sleep in.
Oh.
He has the Velcro wraps, but he also has the compression pants that kind of look like capris. So which ones are you saying that he should not sleep in?
Oh, okay. So if you worked with a therapist to create a plan, I wouldn't worry about that. Velcros are safe for day and night use. And then the capris typically are really low rated. And in most cases, I would say like I wouldn't be worried about sleeping in those just because they're a really low level of compression and they're not on like the most distal part of your body. So in terms of circulation, it's just not as concerning. I wouldn't worry about Velcros so much on sleeping, and those are a safe garment to choose. Yeah.
He has also had just the wraps that look like ace bandages.
Yeah, and those are short stretch bandages that we use for decongestion, and those are safe for day and night as well, as long as they're applied appropriately. Yeah. Yeah.
You want any more questions?
Yeah.
Okay.
Want to know about professional massages? When you have lymphedema, can you have? I mean, I know you're supposed to stroke and do like all that, but do you recommend having a professional?
Like lymphatic drainage. So this is like, for me personally, when I think about where it is in evidence, and because it is not moving any more volume, kind of in what the research shows, if it were my body, I would not go and pay for MLD. I would I'd go get a Swedish massage and enjoy it. And I would do my compression and exercise at home, is what I tell my patients. Now, does that mean it's not an effective tool? Or if you're having a time where you're having a really hard time managing it, that you shouldn't use it? No, but I do think that in terms of like where I would place my importance, I would say I'd rather you be in compression consistently.
So is it dangerous to get just a massage if you have lymphedema?
I don't think there's anything in terms for me, like as long as there's not other things going on medically, that I would say you shouldn't get a massage. I'm just saying that if you're going to pay, because just like massage MLD without like considering as part of a therapeutic long-term like tool, it's something you're paying for out of pocket. And so like in terms of therapeutic benefit, it's not what I would like pay for myself out of pocket.
Is there a therapeutic benefit though? Just get a regular massage.
So there are like massage clinics that have lymph drainage massage therapists. So they basically go through certifications related to the massage component alone, and they're not going to bill through insurance. It's not but they will do manual lymphatic drainage, and they are like trained to do that if they hold those certifications. And it's surprisingly like more frequent than you would think that those are available.
Every massage.
Okay, I guess I can look that up.
Yeah.
You have to be very specific about.
Okay.
I just have one question for you, Abby, and in regards to I'm mostly dealing with mastectomy patients.
Yeah.
Well, what about prevention? What about the initial, because we will tell our patients sometimes, okay, you've had a mastectomy, you travel all the time.
Yes.
Do you advise a preventive? Wear that sleeve on the plane if you're taking long car trips. Wear that sleeve when you're in the car. Yes,
from like this doesn't just have to be breast cancer, but when we know that there's like a lymph node removal or a surgery component that we're concerned about the development of lymphedema, using compression prophylactically doesn't mean wearing it daily like it is when you have developed like the progression lymphedema. It means wearing it at those at-risk times. So travel, long car rides, airplane flights, if you've done something well outside your normal. Now we know exercise is good, but if I have done nothing for the last month and I go to a boxing class, I should wear my compression because I know I'm going to make myself sore, and that's going to, help us move fluid out. So we say use your sleeve in those at-risk times to help support your tissue, move fluid out so that you're not creating the overload that can progress the condition. That's a really good question.
So after going to your GP, he says, he agrees with he can give you a prescription to go to a massage therapist or to go to a clinic and you get exercise.
I would say you need to go to a lymphedema therapist. So making sure that you're going to a rehab place where a PT or an OT is certified in lymphedema treatment.
What if there's none in your area?
That is a really good question because in Atlanta, it isn't as available as we'd like it to be, right? I honestly don't have like a really awesome solution. A lot of times we have patients come from over an hour away for what we do. And sometimes if they're like, I can only come this once, we're going to just do as much education and long-term planning as possible to give them the most they can. And that's, we want to do what we can for you and what you can give us, and we'll meet you halfway.
You need my doctor to.
We need a referral, yes, yeah.
I mean, similar to what Abby said, our goal is to empower you to wear them. We want you to wear them. So we have some blank prescriptions here if you want to grab any while you're leaving. We have daytime garments and then we have nighttime garments. So as mentioned earlier, our nighttime garments are bigger because they're meant to design. Our daytime garments are thinner, but they also come in higher pressures because you're moving around. They're meant for day-to-day, you know, doing regular tasks during the day compared to our nighttime garments. They do come in variations of colors and styles. Some garments can be a little restrictive just because of what it's designed to do. But I mean, you know, you can really have fun with compression garment. It doesn't have to be, I guess, the old school, just the beige and the black. We have pink, we have striped, we have navy, we have a lot of different colors. With compression over the years, it's really progressed to make it somewhat comfortable for you to wear. Yeah, that's pretty much all I want to say. Yeah.
So we can touch stuff on the table.
Oh, absolutely.
Just ask you questions.
Yes, yes, that's pretty much it.
So we just take that to a doctor and then we order it. How do we know the size?
So first, if you're taking this to your doctor, you would call us to make an appointment, and you would come to us to be measured, fitted, and kind of discuss what your problem areas are or what, you know, what you're trying to do. We work hand in hand with the therapist because they kind of gauge as to what we should be doing, what garments fit you, and then they generally send their recommendations over to kind of guide the experience.
We don't take the rest.
No, we have all parts of the body. We have head and neck. We have stockings. Yeah, we all up to the thigh, arm, hand. Yes, it's all parts of the body.
We see men and women. Sometimes men, if they've had, you know, testicular cancer, anything, they will wear compression garments on their lower area. We see head and neck for a lot of people that have had maybe lymphoma or a throat cancer. We see burn patients for compression garments. Compression encompasses just so many things, you know, because there are so many different things that can damage the lymphatic system. So we see many, many, many different types of patients.
Any other questions that you guys can think of right now?
I noticed I got pressure socks from my leg. I noticed on one leg they just keep falling down.
Okay, that can be several different reasons. It could be the fit, it could be the placement, and it could be the size. It may be a situation where if you got it for us, you may want to come back in to be remeasured, be, you know, reassessed. And it maybe could be that the particular garment isn't the best for your situation.
Or it's worn out.
Yes.
If it's older.
Yeah.
But it's only on one leg that it falls down.
Yeah. Yeah.
It doesn't fall down.
On the other one, yeah.
Well, I can say that I have been to the Wellnes Place, and Lena is fantastic. She fits you well, and I mean, I was very pleased.
Good.
And the garments that she, I guess, my doctor prescribed, they fit well. I had a problem with the night garment, and I had to send it back twice because it was just too tight.
Too tight.
But I was very pleased with the service of that, and I'm supposed to go back in about a week or so because the sleeve is over 6 months old.
Yep. Yep. We generally like to recommend the daytime garments are good for about 6 months. Nighttime can last, depending on the nighttime garment, about a year. The Velcros wraps that you mentioned earlier are about 6 months. So it depends on the type of garment, how long the longevity is. Something I like to stress is even if the garments still look good after 6 months, that compression strength is no longer as strong as it once was. That's why that 6 month period is always good to get another set of garments.
Yeah, these are years old.
See?
5 years old.
Right.
They're not working for you anymore.
I have a sleeve from 2002. but it was only to be. So, I mean, I've only used it when I've flown, so only using it like once every 2 years is still out of date.
Yes.
Really?
Yes, absolutely.
Are you
Just
exactly the same size and weight you are in 2002? Shape.
Keep this in mind. All of our garments actually have an expiration date.
Yeah, yeah. We always recommend 6 months. I mean, you feel the difference when you put on a new garment at 6 months compared to a year or 2 years. There's a reason why, they say for you to get it every 6 months. Absolutely. Yeah.
But you have to go back to the lymphedema clinic.
Not necessarily. You can call A Wellnes Place if you got it from us, and as long as your prescription is up to date and you can get refills or so forth, you would just come back in for new fitting, new measurements, and get new garments in.
Oh.
And how long are those prescriptions good for?
A year.
A year from the date it was written.
Yes.
Yeah. So, but then you can just call it. We're happy to, we're both happy to rewrite prescriptions for that. And let people go get fresh garments as they need to.
Dr. Laurel's office is great.
But your doctor should write your own.
Why did my doctor tell me to buy it at Amazon?
Okay, so there's a big misconception with that. Yes, Amazon, Walmart, a lot of other pharmacies do sell compression garments. But the reason what makes ours special and unique is that they're medical grade compression garments. And when you come to us, you're being fitted for a garment that fits you. Okay, so a lot of people try to just go online. Oh, I think I'm a medium-ish or smallish and get something and it's not fitting, or it's too tight, or it's putting off their circulation, or it's rolling down. Those things can't be fixed without you coming to see, someone like us or Jen to really have that experience for your circumstance. Okay.
All set? She can come back. My name is Ginny, and I am one of the mastectomy fitters at A Wellnes Place. We help to provide products from your surgery all the way through the rest of your lifetime, as far as prosthetic breasts and bras and things like that that you might need along the way with your breast cancer journey. A lot of women don't know this, but these are by law covered products for you through your insurance companies. Now, the insurance companies may dictate the quantities and, for instance, the quantities we can dispense and what they will pay, but they do have to cover these garments. Okay. How many breast cancer survivors do I have? Okay. All right. So you ladies know the ins and outs of this probably. Some of you may have been reconstructed. And reconstruction does not always guarantee you are not going to need some type of prosthesis along the way. There could be women who have had radiation therapy and have gone along for years and years and years, and all of a sudden they look down and go, wait a minute, what happened to my breast tissue that it could shrink, it could also get bigger due to radiation. So we offer several different things just to help you through, as I said, this journey, and you're constantly changing, whether it's weight change or medication or anything like that. We will always be there to try to give you the best products that we can to see through all the changes that you might have. When I said we kind of see you from surgery through the rest of your life, when you do have surgery, a doctor like Dr. Barnes might order a camisole, something like this. This is to help you manage the drain that may be put into your system with a pocket. It also provides kind of a little puffy prosthetic in case you should just have one breast
removed or anything like that. We usually wait for healing time, about 6 to 8 weeks, or when you are completely healed. If you have to go through a radiation therapy or anything like that, you may not want to come in and have this done. We always suggest waiting till you're through with your radiation so that there isn't any swelling and we're not measuring like that. But when you come in, we would measure, and what we will do is fit you in a bra initially. Once we find a comfortable garment for you, and these are some of our bras, they look like the same thing you would see in a retail store. Difference being, ours are all wire-free unless you request a wire. They're also wider in the center of the garment and along the side of the garment to support scar tissue. Then you're going to find that the garments have a pocket in the back of them to house a prosthetic. I don't know, who wears a prosthetic or who doesn't wear a prosthetic, but we offer different shapes, different sizes, everything like this to accommodate a patient. If you are one of those women who may have had reconstruction, for instance, you may have had reconstruction on one breast, but it's still just a little bit off. The doctors can't kind of foresee. A lot of times they will do what they call fat transfers, but that fat that they transfer can sometimes resorb into your body, where it would leave you perhaps one side is smaller than the other side. We have different thicknesses of prosthetics that we offer to just help a little bit, maybe push that one side out that you need the help with. But there are all types of garments and products available to you ladies. And we do see gentlemen that have gone through breast cancer. A lot of times they will get the lymphedema and need to wear the lymphedema vest. Obviously, they may or may not want to put breast tissue back, but the only way they're going to hold that in is either with a bra or, for instance, what we call an adhesive prosthetic. So we just have all types of things available to us and for you. So, questions? A full room, yes. And camisoles, these are actually breast garments also. You could do something very casual and you'll be able to place a prosthetic. We even have, I'm sorry, you're good? We even have prosthetics these days that blow up in the back, because a lot of times women will have a concave chest wall, and we can't, if you put a prosthetic on that concave chest wall, we lose a lot of the prosthesis. So with this type, you actually put a little pump in the back of it and it can blow this up. So it kind of, compensates for that emptiness in the back. So, questions at all? Nope. We do offer swimsuits. There are also different retail outlets. Land's End, I know, is they have pocketed swimsuits that these can fit into. So they are a good source. But we also have them.
You have special prosthetics that
for swim? Yep. This is like a little bean bag and the water runs right through the prosthetic. So it is helpful. Also, if you're a big swimmer, we've got all your issues taken care of, hopefully. And if we can't find something kind of in our arsenal of prosthetics, they also do custom prosthetics, where we actually have one of our vendors come in and scan your chest wall, and they make that prosthetic specifically for you to only fit your chest wall. So, okay. Well, we've got pamphlets, we've got eyeglass cleaners and little chapstick holders. Help yourselves, and our pamphlets are there if you should need any of the compression services or the breast care services. Thank you.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.